Yeah, Nate Lance, December 15th, 1997.
Awesome. Well, Nate, I'm here to perform tracheostomy care. Have you had that before? Do you know what it is?
Yeah.
Okay, so you're probably familiar with it, but I'm just going to be cleaning out your trach today, and I'll kind of walk you through what I'm doing as I'm doing it, but if you have any questions, feel free to ask, okay?
Okay.
I'm going to go ahead and lift your bed up right now, and then I'm going to go ahead and gather some supplies. All right, so I got the tracheostomy cleaning care tray. I have grabbed extra supplies like gauze and swabs if I needed. I will also grab a second pair of sterile gloves. And I'm just going to be pretending that these are sterile gloves today. I'll place them right here. Great. So now I'm going to go ahead and prepare my kit. And I'll be hyperoxygenating the patient right now. All right, neat. So I'm just going to go ahead and place this sterile towel on your chest, and I'll just be using that. And I will pour some sterile water into this kit, the liter. And now I will go ahead and remove the oxygen, place it to the side. And I will apply my sterile gloves. Okay. And now with one hand I'll make it my clean hand, and one hand will be my sterile hand. And I'm just going to connect the sterile suctioning device to this. Perfect. Now I'll go ahead and insert it until I meet resistance. Okay, and then I will suction as I pull out. And I would do that again if needed, but it looks pretty clean. So I'll keep this here just in case I need it again. And then I'll replace his oxygen. And then I will go ahead and pull off his dressing here. And then also carefully pull out his inner cannula. And I would have a new sterile one, but to conserve materials, I'm just going to pretend that this will be my new sterile one. Alright, and so now I will go ahead and replace my gloves before I clean his site. Perform hand hygiene in between as well. Alright, it's a little bit of a struggle, but let's fix that. Alright. So once I get my sterile gloves on correctly, then I will go ahead and replace that inner cannula. I'll have a clean hand, and I'll move that oxygen to the side. And then using my sterile hand, I will carefully insert the new inner cannula and make sure it's locked into place. When I pull it out, there's no sliding out. And then I will go ahead and clean using sterile gauze with the sterile water, and I'll start from the inside and move out. And every time I would replace my gauze, but just for conserving materials, I'll pretend that this is a new one every time. Okay. And if I need to get some smaller areas, I can also use the swabs, but it's looking good. I would also assess the stoma at this point and also dry it. It's looking good, nothing alarming. It looks warm, dry, intact, and no drainage that is concerning. And so now I will use my clean hand or my sterile hand and replace the dressing. I'll also assess the straps on the tracheostomy and change those out if I needed to do that. And then I'll replace with oxygen. All right, Chuck, how did that feel? Was that okay?
Yeah, that was fine.
Great. So I would now do an assessment on Chuck, just listening to his lungs, making sure his vitals are good, and from what I see, everything sounds good. So I would document his vital signs and his oxygenation, and I'd also document the assessment of the stoma site, which I didn't see anything abnormal. It was warm, dry, and intact, and no drainage. And then I'd clean up my area and make sure his bed was in the lowest position, and the 2 side rails are up, and he has the call light in reach. I would clean this up.